presentation. It's about 16 slides, take about 10 minutes to go through it. I'm going to focus on what is M-governance, which is the next generation of public services, and talk about the global ICT developments also, and then what are the benefits and challenges, the value chain model, how one can go about it, the policy formulation and guiding principles, the adoption model by government, then what kind of government to citizen, government to business and government to enterprise services can be incorporated, the impact of such a model. Then I'll just highlight some of the key international governance projects like this, both in India and also abroad, and then come to the end about what is it that is possible in India. Now, what exactly is M-governance? It is the adoption of mobile technologies to support and enhance government performance and foster a more connected society. It is emerging as the next big wave of information and communication technology used in the public sector. It ensures, of course, that there will be innovation in service delivery. It will empower digitally deprived citizens. It will intensify partnerships and exchange between public and private sectors, and it will also enhance public sector performance and good governance. In the public health department, we at the moment are using something called the pull SMS that is generated from hospitals down to the PHCs, and also our mobile medical units, and also bulk SMS, in which we get daily information of the figures on number of IPD, OPD patients, the deliveries that have happened, the babies that have been born and their birth weight, and so on and so forth. This slide I wanted to show you because this it's very graphically shows that the way the mobile penetration has changed in the world. Ever since we have moved from fixed telephone subscriptions to mobile cellular subscriptions, you can see that both in the developing and the developed world, there has been a huge penetration led by the mobile technology. There are, of course, many benefits, so are there many challenges. If you look at the very typical conventional government model, it's available only for fixed number of hours, it's only for the working days, and so if there is a holiday or a public holiday or a weekend coming in, then you find that you are not able to access many of the services. Whereas if you look at e-governance, then it is available perhaps 24 hours, 7 days a week. You can use it from home as well. You can access it easily. But when you go more forward to the M-governance model, then there is a total seamless integration and linkage of wireless devices. It's available 24 hours, 365 days. And it is irrelevant where from you are accessing the information or the service. All you need is the access, and you shall be able to continuously seek those services. So the benefits are that it has a much wider reach. It is, of course, mobile. There's more personalization of services. It's more cost effective. There's faster information flow. It's better managed. There is more democracy in it. It also enables a green government. The challenges are there's a cost involved, and who is to pay for it, that becomes an issue. There could be an M-digital divide. You will find senior citizens often getting deprived and left out of this model. And then sometimes there is a mindset that people feel that this is more for entertainment rather than for actually doing any serious work, and so on and so forth. This I just wanted to show you because what it talks about is how can you actually implement it. There are, the regulatory framework has to be first made very clear. The funders have to come into play. Some amount of funding can come from the government, but you also need private partners to chip in. You have to, the government would obviously be the main mover, where it would aim for developing systems which can do better analysis. There's more integration, there's more interoperability, so that in case there's a database which has been created under one program, it can be accessed by other departments and duplication can be avoided. It's more reliable, security would be an issue, and so on. And what it would lead to ultimately is more engagement of the citizens, better customer services, improved economic development, and some of the sectors which can be affected by it are health, governance, payments, enterprise applications, mobile workers, and also improve public safety. It would impact, of course, citizens, business, and government all alike through, of course, the service provision. There has to be internet service, and there has to be mobile service, and there have to be platforms through which the access can be provided to access those services. Now, policy formulation would necessarily have to take into consideration the following key features for the next generation of services. It has to be a more citizen-centric approach. We will have to move towards a system or a model where service becomes the key word, the buzzword, and how can citizens access that service. It still remains a challenge despite many efforts having been made already, and it will definitely increase transparency and the citizens' ability to measure what kind of impact government programs are having in their area and how they can participate in the development. So M-governance is not really a substitute for e-governance. It does not replace. All it means is that there would be applications which can run on mobile devices, but not all applications can run on mobile devices, and therefore the e-governance cannot be replaced totally by M-governance. It has to be conceived and developed as an overall part of the e-governance strategy of the government, and we have to balance the M-government applications. It should not be so trivial, and it should not either be too difficult for anybody to use. In deploying these applications, we have to ensure that citizens also get what they are seeking in the shortest possible time. If the system is so cumbersome that access becomes an issue, then it is not going to work. Now, the M-government adoption model by government could possibly look at these 4 sectors. What are the government to citizen services that can be provided? What could be the interaction of government with businesses and the different permissions, etc., that are required by businesses? It could also become a tool for conveying important messages between government and its employees, which I think is often not utilized to the extent it can be, and also from government to government. It could be interagency sharing of information and also database. So it could be both individual and organizational. Most, of course, the mobile applications which are likely to be very popular are the ones which will be government to citizen services, which will allow the citizen to not only seek information from the government, which often becomes an issue. We know the kind of revolution the right to information has created, for example, and it can request services, ask questions, it can complete transactions from the security of its own home or workplace, and it can also give very important and crucial feedback, report problems, and request emergency assistance and access data. So therefore, the M-government model, which would be very relevant for government to citizen services, could fall under informational and educational services, interactive services, transactional services, and government to citizen engagement. Here I would like to just pause and give you an example about how the PWD department in the state of Delhi made a switch over from recording of complaints for repairs which were done first in the traditional manner to a system where you just had to call 1-800 number and register. You had to inform them about your location, the type of problem you have, and register your complaint. And then it became so easy that within 24 to 48 hours it was being attended to. This eased the problems faced by people who were constantly pursuing the PWD during working hours and not finding those people on the desk. And the PWD further outsourced the repair work to a number of agencies who would look into plumbing, electrical problems, and so on and so forth. And so the whole thing started working in a much more organized manner, and it definitely also reduced to some extent the kind of inefficiency that one would normally encounter with the PWD. I have already mentioned this, but where I want to focus a little bit is on the interactive services, the health services, and also education and other sectors. I feel that if we can include certain packages at the time of giving a SIM card of a mobile phone to citizens, then there are so many things that citizens could get informed about without government having to then spending a lot of money on creating awareness about what they need to do. So simply, in addition to, people nowadays surf the net for weather information, they surf the net for additional information about a place they are visiting or traveling, etc., exchange rates, gold rate, and all those things. But it could also impact very well in these social sectors like health and education, and also security, where you could be reporting a crime that you've seen an accident and you would want to report it immediately. Everybody today has a phone in his hand or her hand, and it could really cause a social transformation in the way people report. I would skip this for the moment and come to this. What is going to make this development model successful is, first of all, the way the government policy is set. How do we impose conditions on service providers, and what kind of promotion we do through our various agencies. There could be possibly certain cultural factors which would inhibit. Some people may not easily take to it. It may have a period where there would be some amount of delay, and not everyone would be on the same page. But over and above, nothing succeeds like success. So once people realize the value of using mobile technology, and also that the costs are low, there are no social or other barriers. If once you start using the service, everyone is treated as equal, then it is definitely going to set the tone for further penetration. And the areas where I've already mentioned this, it could be very effective are health, education, commerce, e-commerce especially, entertainment, investment, civic participation, and safety and security. The impact of m-governance so far, therefore, has been that it provides government a new channel to transmit its policies and its services to people. It is something that would raise awareness amongst users, and it could become a very critical area of development in future. These are some of the key international m-governance projects. I took them out from the net. As you can see, we have already heard about weather and traffic related issues being sent out to people, but in certain countries it is being even used for reminding people to return their library books, and so on and so forth. Even in a country like Rwanda, they have a system that allows students to access their national examination results via their mobile phones. I don't know if it happens in India. I am not sure about that. In Bahrain also they have a very interesting service. Singapore, of course, Istanbul, Malta, Turkey. These have been some of key m-governance projects in India: the Darknet, then the Lokwani, the Voice of the People, an innovative model of citizens service centers. They can register and track their own petition in a nearby kiosk, and SMS-based services for challan status inquiry. I'm told that the Customs Department effectively uses this system. You can actually track your package which you have booked for overseas cargo. Health projects across India, very, very interesting. The first one, patient appointment scheduling of medical institutions. This is being done in Delhi quite successfully. And subsequently, the second one, battling counterfeit medicine with an SMS. I'm told this is a project that has been taken up by some pharma companies. Pharma Secure is a company which has actually led the setting up of this system. And then survey of hospitals to check compliance for IPHS is being done by Kerala. And this disease and epidemic outbreak tracking is being done by Gujarat and Kerala both. And again, this doctor SMS providing details of your nearest health facility is something that Kerala is doing. So call and get either a regular ambulance or blood on call 104, and 108 is for emergency medical service. So if these could already be preloaded on the SIM cards, then citizens could access them. I mean, you don't have to carry out a separate advertising campaign to inform people about the use of these numbers. You could also access patient records and lab test results. You know, you have something like this Lal Path Labs. You just go to the website and you can find out if your lab report is done and is already loaded. But it could be linked to mobile technology. The message could, I think they do send a message out on your mobile also once your report is done. But this could become like a normal thing, that even if you went to any other lab, you should be able to get a reply that your report is ready. It could also, this is something that we are looking at now in Maharashtra, because our blood donation is really dipping and we don't have sufficient blood stock at times. So if at the time of registering for a SIM card, if a person is also asked to indicate their blood group, then whenever there's an urgent need, a message could be sent to a couple of donors to report to the nearest place wherever blood is urgently required. SMS alerts on outbreaks and preventive measures are quite common. We don't do it, but I think this is something that we could do. There is an organization called the GDAX, and they run a system where you can either go to the website or you can register yourself, and they'll give you an alert of any category 5 or 4 disaster anywhere in the world. So when the tsunami hit Japan, all those people who had already registered on the site got almost instantaneous message that there has been a huge earthquake in that region. Similarly, electronic billing for in-home healthcare workers could be done, especially ANMs and ASHA workers. There could be better awareness generation on health and safety education by giving messages, and so on and so forth. I think text for baby is an excellent concept that could at least advise pregnant mothers and new mothers that their vaccinations are due, because even these people have their mobiles. So this could become another penetration for the health department to look at, and so on and so forth. So thank you very much.